So first of all, thanks everyone for joining us. I'm very excited to let you know that we're adding LPS to the gut barrier panel. So the gut barrier panel, which you were all just getting comfortable with in terms of our Candida, Zonulin, and Occludin, is now getting LPS as well. So again, I'm excited to bring Dr. Rob on to explain a little bit more about LPS, not only the importance of it, but also to see how you can help treat LPS and link it in with some of the symptoms that will be shown up with LPS. So again, in line with the fact that gut barrier panel is helping you look at this as a continuum, we wanted to give you even more information. So the LPS will be added to the gut barrier panel as of now. And on top of that, it will be included with the FIT 176, the FIT 132, and a standalone when you look to retreat your patients after you've looked at some of these great protocols that we've added in as well. So without further ado, let me hand over to Dr. Rob to wander you through LPS and its importance on the new KBMO gut barrier panel.
Well, James, thank you so much for the opportunity to collaborate with you and colleagues. I am stoked to be able to talk a little bit about LPS and share a test that I've been using in my office, and I am finding revolutionary outcomes by being able to utilize when somebody unfortunately shows an expression of LPS. As we know, LPS is lipopolysaccharide. It actually holds gram-negative bacteria on the inside of the intestinal wall, but it hangs on the outside. Most of that gram-negative bacteria is pathogenic. Unfortunately, LPS, when expressed, we call it an endotoxin. It acts as a strong stimulator of the innate immunity in humans. It does so by triggering a vast number of inflammatory cytokines. LPS on its own can actually cause damage in the gut lining. And lastly, LPS is known not only to hurt the gut, but it also can pass the blood-brain barrier. So to piggyback on that idea, this particular study really spoke about the idea of how LPS damages the gut and the brain, and it's a detriment to what I like to refer to as the superhighway to health, which is the gut to brain axis. So a critical element, a great add to the gut barrier panel is LPS, because you're able to screen for specific damages to the gut and the brain. Now, interestingly enough, once LPS passes through that gut barrier, you can see by this slide the plethora of different organs and joints that can attach to. LPS being an endotoxin, again, I'm going to highlight the gut to brain axis, but from my chiropractic background, it damages the central nervous system. It can damage the spine. It can damage the joint. It can damage the thyroid. It can lead you down a path of metabolic disorders, lung damage, immune modulation in this era of everybody talking about immunity and post-COVID and whatnot. Without question, the expression or the systemic expression of LPS can be linked to multiple disorders. This one gets a little heady, if you will, but I think it's real revealing on how detrimental LPS can be to one's overall health. As you see on the left side of the slide, LPS is released, obviously, through leaky gut or damage in the epithelial lining. LPS attaches to something called toll-like receptor 4. Toll-like receptor 4 is a receptor site in the gut, which signals the release through NF-kappa B of interleukins and cytokines. So there's a couple of quick little practice management tricks. One, obviously trying to avoid a leaky gut. Two, if your gut becomes leaky, what's one of the things you could do to block the expression of LPS from attaching to toll-like receptor 4? Omega-3 fatty acids. Now, what's most interesting about this slide, again, which is really explaining how LPS leads to NLRP3 inflammasome, is that there's a secondary signal, and that secondary signal can get blocked by ketone bodies. So here's what I'm saying. The expression of LPS leads to the release of specific interleukins and cytokines, which are very inflammatory systemically to the body. A good way to stop it would be obviously a gut barrier panel or a gut barrier protocol, omega-3 fatty acids, and ketone bodies. That being said, again, I'm going to go rely on my chiropractic background. How many patients come in, all the practitioners who are listening to this, and have muscle pain? Well, that muscle pain may be attributed to the expression of LPS. So rotator cuff, lower back, incidentally, 8 out of 10 Americans have lower back pain, ankle pain, joint pain, any kind of malaise. It could be due to the expression, once again, of LPS. This slide hopefully really puts it all together in one tight bow, if you will. LPS is a potent endotoxin and a major inducer of the inflammatory response. It's also a major component, as I said before, of the cell wall of the gram-negative bacteria that colonizes the intestines. Trillions of bacteria occupy the gastrointestinal tract, providing a huge reservoir of LPS endotoxin. Normally, only a small amount of LPS absorbed. However, when you use a high fat, when I say high fat, we're talking high saturated fat, or without question, a high carbohydrate diet will lead to an overexpression of LPS absorption and endotoxemia. Now, more so than that, the big takeaway here is increased LPS absorption can lead to endotoxemia and increased localized and systemic inflammation, and ultimately molecular mimicry and possibly autoimmunity. So the takeaway is increased gut permeability is leading us down a path of increased endotoxin absorption. And here's the test. Before I get to the test, James, did you want to dovetail anything in?
Yeah, I mean, I think the neat thing, as you've mentioned, is the importance of LPS. We've also got the 3 protocols now in terms of on the supplement side. We're working with Biotics, Nutritional Frontiers, and Nutridyne, and happy to share all 3 of those with everyone to make sure we give you guys some ideas of how to treat the gut versus going, oh my God, here's another test that I haven't got an answer for. The idea is, here's a test, and here's we've worked with some really good professional supplement suppliers to make sure we've got some really good protocols to help you guys treat your patients. And that's really the key to that. So that would be our thought. Now, Rob, what do you think about LPS in terms of, we've talked about the interpretation in that other short 7-minute video. How do the providers now look at LPS from an interpretation standpoint?
So LPS, like you said, has been added, and the interpretation is as follows. So in this one, if you look at the last line, you'll see LPS is negative for an expression of IgA 1 through 2. So LPS in this particular patient example did not stimulate damage or is not at this point stimulating damage at the secretory level or at the epithelial level. However, it is positive for an overexpression of IgG 1 through 4 and C3d. So what that's saying is, in this patient, they've had long-standing inflammation, and it's coupled with additional inflammation, not just from the adaptive immune system, but also with the expression of C3d, which we all now know is the most inflammatory molecule, stable inflammatory molecule in the body. So I look at this and I say, just in the LPS realm, this is going to take a bit of time to help them get over this. If it was more of an IgA and not IgG, it would be a shorter period of time. Unfortunately, LPS, when shown to be positive, usually takes a longer period of time as opposed to maybe just an expression of Candida. Now, of course, like you said, we have a lot of moving parts. You want to do it as an N of 1. You want to look at the whole test. And in a whole test, you want to determine what direction to take the patient. You've got the 3 different companies that you alluded to. And, this really shows LPS the full disclosure of what's going on inside at the gut level, and really is quite exemplary of the idea of testing and not guessing when you want to teach a treatment protocol for the gut.
Perfect. That's great, Rob. And again, we can go into more depth at some point, but we recognize people's valuable time. So again, hopefully this will be a great way of updating everyone's knowledge on LPS, how to interpret it in the gut barrier panel, and with the protocols, great ways of actually treating it to make sure that we can heal your patient's gut and focus on the inflammation caused by the FIT test. So thank you, everyone. Again, hopefully you can tell we're pretty excited by this edition, and we look forward to hearing results back from you in terms of how this is helping your patient population. So thank you all, and excited for you to get using the LPS, which is now on the KBMO Gut Barrier Panel. Thank you again, and thank you, Dr. Rob, for all your help on this. Cheerio.
My pleasure. Good luck.